Mhm.
Good morning, sir.
Morning. You have any class now, students? CVT? Okay, okay. You can continue. Okay. So far we have 15 students here. Um, just a minute, students. I will close the door. All right. So, okay. Good morning to everyone. And now we have totally 19 students in online. Okay, 18 students. They include Akib, Abhishek, Afrin, Anukriti, Arman, Gaurav, Jyotipati, Mahima, Mohammad Kashif Ali, Mohini, Nandini, Nikita, Ravi, Sahil, Shivam, Shreya, Shruti, Sumit, Vivek. Okay. So I will do a quick revision of yesterday's topic and we can proceed to the today's topic. So today my major topic will be AED. AED stands for automatic external defibrillator. So before AED, let us discuss last lecture where we discussed about a CPR, cardiopulmonary resuscitation. So let us see what is PCR. A quick review of CPR, not PCR. I'm sorry. So CPR. Okay. So, okay. Are you listening, students? Is the PowerPoint visible to you?
Yes, sir.
Yes,
Perfect.
sir.
Yes, sir.
Perfect. Very good. Okay. Just a sec. Okay. So, hmm. So cardiopulmonary resuscitation. So what is cardiopulmonary resuscitation? It is an act of keeping the circulation of a patient who is unconscious. If a patient become unconscious and he is laying on the ground, means we need to keep his circulation active. By how we can keep his circulation active? What is the responsible for his circulation? So circulation is mediated by the heart. So if there is any heart abnormalities, if the heart is not beating properly, obviously the circulation will be diminished. If there is no circulation, lack of circulation will cause a lack of oxygen supply to the organs. So organs won't get proper blood supply. If there is no blood, there won't be no oxygen to the organs and organs will start dying. So particularly, there is one particular in our body that will demand more amount of oxygen. Can anyone guess what is the high oxygen consumption organ in our body? Do you have any idea, students? Which organ will consume more oxygen? What organ in our body will consume more oxygen? Do you have any idea which organ it is? Mm. Hmm?
Lungs. Lungs.
Not lungs. Mhm. I'm saying which organ will utilize more oxygen. I'm not asking which organ will receive more oxygen. I'm asking
Sir,
more,
heart.
not heart, not lungs, not heart. Any other guesses? To this particular organ, if it is not getting oxygen for 1 minute, it will start stopping its actions. If this organ did not get oxygen for 3 minutes, it will go to shutdown state. If it's not getting oxygen for 5 minutes, it will dead. You know what is
Brain.
that organ? Brain, actually. Yes, brain is the primary or 78%, almost 80% of oxygen will be utilized by the brain actually. So when you are taking a deep breath, if I'm taking deep breath, out of this air, 80% will be diverted to the brain and only 20% will be utilized by the other organs in our body. So brain is the most oxygen consuming organ in our body because it need to do many calculations. So obviously brain needs more oxygen. So why I'm telling brain in CPR, because If the brain not getting blood supply, the brain will go to coma. Within 3 minutes, if you are not giving oxygen back to the brain, it will go to coma. If you are not giving for 5 minutes, brain will dead. Game over. The patient will be legalized as a brain dead patient, and you cannot recover the dead brain. So that is why when a person become unconscious, immediately we need to start giving circulation to his body. How we can give circulation to his body? We can give circulation by mechanically pressing his chest, mechanically pressing his heart. Just a minute, I got a call. Himanshu, yes, where are you? Class, ma'am. Okay, ma'am. I will. Okay, I will go to there. Off. Okay, okay. Uh, I have up to 10 o'clock, ma'am. Okay, I will go, ma'am. Students, just a minute. Himanshu, come to here. Come to third floor. Um, just a minute, students. I will back. Okay. You can go. Okay. Are you listening, students? Can you
Yes,
hear?
sir.
Yes, sir.
Oh, okay. Sorry for the interruption.
No
Okay.
problem,
So
sir.
yeah. So the point that I was making is keeping the circulation of patient is very vital to save his life, because if his brain stopped working means he will go to coma, and it will cause an irreversible damage to the brain, and the patient will be in permanent uh, dead state. So that is why keeping circulation within the body is important, and that can be mediated by the CPR, and also CPR will reactivate the heart. Okay. So a quick revision of yesterday's lecture. So if you see someone, if you see a
हेलो निशान।
हाँ
सर नहीं आए थे क्लास में?
सर आ जाते तो पढ़ाई होती ना, अभी ना है तो बस देख ले।
अच्छा, मस्ती कहाँ कर रहे हो तुम? चुपचाप बैठे हो।
अरे कुछ भी नहीं कर रहा, मैं तो सो रहा था, एकदम आँख खुली है।
सही है। आ रहा है सर, मैंने कॉल तो किया है।
तुझे बहुत जल्दी रहती है पढ़ने।
मैं कॉलेज में हूँ, ठीक है, करूंगा नहीं। क्लास बंद है, ठीक है। आप
चल ठीक है।
पता है 60,000 दिए हैं, फ्री के थोड़ी नहीं है। 60,000 जल्दी रहेगी नहीं। हाँ,
अकेले ने तुम्हें थोड़ी ना दिए, हमने भी दिए।
तो अब तुम्हें जल्दी ना है तो हमारे लिए तो जल्दी है।
अब भी अपसेंट लग रही है भाई
किसकी?
मेरी।
चेक कर तो ठीक है।
हाँ
All right, students, can you hear me? Yeah, I'm sorry for the internet issues. There are many fluctuations in internet, so that's why I was delayed. Okay, so simply, students, see this short animation. So when we started giving CPR, the blood circulation will eventually it will increase to the brain. See the brain becoming warm and warm. So now the brain getting enough circulation, so the brain will get activated. Now the brain activated, and also the heart will start pumping by itself. See now the heart will start beating by itself. So at certain point, heart will reactivate, and the heart will start functioning. So this is the major advantage of CPR. Okay, so you need to give repeated compressions on the chest for 30 times. So 30 times you need to give repeated compressions on the chest, and after that you need to give 2 oral breathing to the person. So artificial breathing we must give to the person. So this is the procedure of CPR. Okay, see at one point heart will start beating by itself. At one point heart will start beating by itself. See, slowly it will start functioning. So this is
So how much pressure we have to apply on this?
how much pressure we need to apply means there is a certain, okay, the rib should go 2 inches down. When we are pressing the ribs, it should go 2 inches down into the patient. So compression of 2 inches of ribs indicates a proper pressure.
Okay, sir.
So the pressure is equivalent to 2 inches compression of the rib cage. So that is the pressure we need to apply.
Okay, sir.
So see this with animation.
Before approaching. R is
So
for
first danger,
response.
we need to sense the
Shake them
danger.
gently by the
To
shoulders
response,
and
to
ask them
ask
loudly, "Are you all
the
right?"
patient all right or
If there is no response, you need to S. Shout for help, as any assistance
shout
will
for
be
help.
helpful.
Then we need to
A is for
open the airway.
airway. Gently tilt the head back like this to open up the airway. B is for breathing. Look, listen, and feel for signs of normal breathing. Look for normal chest movements. Listen for normal breathing sounds. And try to feel their breath against your face. Do this for no more than 10 seconds. If there is no sign of breathing, or if they are breathing in an unusual, noisy way, we need to start CPR. First, make sure that an ambulance is on its way. If you have someone with you, ask them to make the call. Putting the phone on speaker mode is useful as the ambulance service can talk you through the steps. C is for circulation. Circulation means the flow of blood around the body, and when the heart stops pumping, we need to take over this role by pushing down hard and fast on the chest. Start by placing the heel of one hand at the center of the person's chest and interlock your fingers like this. With arms straightened, press down hard and fast, letting the chest come back up fully each time. Fast means around 2 times every second. And hard means that the chest needs to go down by about 5 centimeters. This might sound a lot, but you do need to push hard for it to be effective.
Almost 5
If you have been
centimeters or 2
trained,
inches
you can give
to press
2
it.
rescue breaths after every 30 compressions, as this
After
helps
compressions, we need
provide
to
some
go 2
oxygen.
rescue breaths.
However, if you have not been trained or are not comfortable, just keep going with hands-only continuous chest compressions.
Then even
If
after
someone else
giving,
is with you, swap over if you begin to feel tired, and don't stop until either a health professional takes over or the person is definitely breathing normally. Sometimes we can add another step. D. D is for defibrillation, which is about delivering a shock to restart the heartbeat. Some public areas and workplaces have an easy-to-use defibrillator on site, called an automatic external defibrillator, or AED. Automatic means that it is the machine that decides what to do, so you can't go wrong, and it even talks you through the steps. If there is no AED available, keep going with CPR until the ambulance arrives. That's it. So to recap, remember doctor's ABC, and if you have it, D. That's D for danger, R for response, S, shout for help, A for airway, B for breathing, C for circulation, and D for defibrillation.
So I hope this point is very clear for everyone, students. So a quick, let us try to memorize these steps. So DRS, ABCD. So ABCD is very easy. A open airway, B breathing, C ensure circulation by compressing the chest, and D defibrillator. If we have that instrument, we can give electric shock to the patient. So ABCD is clear, and starting three letters are DRS. D stands for danger, R response, and S for shout for help. So these are the major steps of CPR. We need to sense the danger, we need to respond immediately, we need to shout for help, we need to open the airway of the person, start giving oral breathing, we need to check whether he's breathing or not. Immediately we need to start CPR by compressing the chest almost 2 inches down for 30 times, and we need to give oral breathing in between, so which is circulation. Then if possible we must give the electric shock to the patient, which is defibrillation. So these are the steps of CPR. Okay, so see, even after giving CPR, still the patient is not responding, means then we should go for defibrillation or AED or giving shock to the patient. So this will be the last step that we can do until the ambulance coming to rescue the patient. So these are the steps. So let us see the introduction to CPR. So CPR stands for cardiopulmonary resuscitation. So it is a life-saving technique which is useful in many emergency situations where in cases such as the stoppage of heart or drowning of patient in the water or any breathing abnormalities. At this condition, CPR will reactivate the heart and it will recirculate the blood in the patient, and also it will ensure that all organs getting blood. So the definition of CPR is cardiopulmonary resuscitation is a technique of basic life support for oxygenating the brain. As I said, keeping brain oxygenated is one important parameter, and also it will reactivate the heart. It will reactivate the heart to normal functioning. So that is the major goals of CPR. Okay, so this is the definition of CPR. And what are the purposes of CPR? So we are doing the CPR to maintain open and clear airway to the patient, to maintain breathing by external ventilation, to maintain blood circulation by external cardiac massages, to save life of a patient, and to provide basic life support till the medical care arrives. So these are the purposes of CPR. Indications for CPR include cardiac arrest, ventricular fibrillation. Ventricular fibrillation means it is an abnormal heartbeat. Abnormal electrical conduction in the heart is called as ventricular fibrillation. At this time, we should approach an instrument called AED. I will discuss AED in the next lecture. These are the few indications for performing CPR. And other indications include respiratory arrest. So this is the major problem. When the patient is unable to breathe, immediately we need to give CPR. If he what it states, what is person not breathing? Person not breathing means he has some heart problem or he has some breathing abnormalities. So that need to be restored immediately. So respiratory arrest can occur due to drowning of patient in the water, or I cannot say patient rather than victim. If the victim is drowning in the water, then he can't breathe. If he has stroke, his respiratory, he can't breathe. Okay. If there is any foreign objects in the throat, then he can't breathe. Smoke inhalation will stop breathing. Drug overdose will cause breathing. So there is a suffocation, accidents, coma, and even epiglottis paralysis will cause arrest of the respiration. And immediately we need to start giving CPR to these patients. So that's it. So the basic steps of CPR include approach safely to the patient, check response whether the patient is responding to us or not, and shout for help and immediately call for 108. Then open his airway and keep his head in a sniffing position so that the patient can able to breathe properly. Then start after keeping sniffing position, see whether the patient is breathing or not. If he is not breathing, immediately start doing the chest compressions. So you immediately start giving your CPR, the chest compressions. Okay, 30 chest compressions for you need to give for every 2 seconds. So you need to maintain 2 seconds. So 2 seconds, one compression, 2 seconds, one compression. So you need to maintain the interval of 2 seconds for each compression, and the force of each compression should be equivalent to the compression of the chest 2 inches down. So the chest should compress 2 inches. So that is that much force you need to apply on the chest cavity. So that is the act of doing CPR. Then every 30 compressions, you need to give air through his mouth. Okay, and we need to ensure that the patient rib cage is elevating up or not. So these are the basic steps of CPR. So approach safely to the patient, check response, ask the patient, are you all right? If he is responding, fine. If he is not responding, then shout for help. Open his airway by keeping his mouth in a sniffing position where you need to hold. Can you, Himanshu, stay online, Himanshu. Okay. Okay. So open airway, then check breathing. Okay, sniffing position. You need to keep the patient in a sniffing position, then call 108 and immediately start giving compressions, chest compressions on the patient like this. Okay, so you need to interlock your fingers like on the patient. So it should go almost 1.2 to 2 inches deep. This is the compression force that we need to give to the patient for 30 times. After 30 times, you need to give 2 rescue breaths to the patient. So this is all about CPR. Then we discussed about complications in CPR. So when we are compressing the chest, we need to ensure that we are not breaking his sternum bone or we are not breaking his respiratory rib bones. If we break the rib bones, means that will be another complication. Okay, we need to deal the victim safely. Okay, softly, not too hard on him. So we need to ensure we should not we should not fracture the ribs. We should not fracture the sternum. We should not separate the ribs. Okay. That is why if you don't apply too much force on the patient, okay, and it can also cause complications like pneumothorax. That means entrapment of air in the lungs, hemothorax, blood entrapment of blood in the lung, and lung constitutions, or it will cause liver lacerations, fat emboli, HIV, hepatitis, or even infections can occur if you damage the internal organs of the lungs. So these are the few complications that we can encounter during CPR. So that's it. So that is all about CPR. See, I'm doing revision of last lecture. Okay. So read and study. I'm positive that you're all studying during the class itself. Is CPR clear for everyone, students? Shall we go to next topic?
Yes, sir.
Yes, sir.
Right?
Yes, sir.
Yes. After CPR, if the patient is still not breathing or not responding, means immediately we should give the shock. So next I'm going to discuss about AED, how to give shock to the patient, and what is AED. I will discuss that. So let me close this PowerPoint.
దేవంట సార్ అభిషేక్ దినేష్ మంచోడు పని చేసుకోడు రాగా
Okay. Just let me know if you see the PowerPoint, students. Can you see it?
Yes, sir.
Yes, sir.
Perfect. Perfect.
Yes, sir.
Very good. Very good. Very good. Okay. So as the name suggests, it is called AED. AED means automated external defibrillator. And I also keep a nice animation here. Now you can understand the purpose of AED. See, students, the heart will beat due to electrical conduction. So see, okay. Before that, I want to discuss one important thing. As I stated, uh, if you see the statistics of top 10 causes of death, so worldwide, the top 10 causes of death are these. So most wanted suspect of death is heart strokes. Ischemic heart diseases are the major death causing events. So stoppage of heart is one of the primary cause of death, and each year there are 10 million people are dying due to heart attack. 10 million people is not a small number. 10 million heart attack. So why it is so danger? Because it is level 1 triage response. So level 1 means they need within 10 to 20 seconds they need to get the care, emergency care. If they are not getting emergency care, that's it. We will lose the patient within 3 minutes. So heart attacks are one of the major global cause of death. So others include lower respiratory infections, and lung infections are the second cause of death. So both lung infections and heart diseases are the major cause of death. And if you see the reason for this heart attack, it is due to diabetes and also obesity. Obesity and diabetes are the silent killers. So if you have diabetes and obesity, try to keep an eye on your blood sugar values or your fat levels in the body. If they are going high, means that will definitely show effect on the heart. You may encounter death any time if you have diabetes or obesity. So if the patient has this heart problem, means immediately he need response, and that can be triggered by AED. So AED is the best instrument that we can use to reactivate the person's heart if it stopped. So AED reactivates the person's heart. Okay, and this is the statistic of in India. So as of 2015, in India also the major cause of death is ischemic heart diseases, which is heart attacks. So heart attacks are, no matter whatever country it is, heart attacks are the primary cause of death. So we need to be very cautious in responding to the person who has heart attack. Okay, so this is a normal heart, and here you can see heartbeat occurs due to electrical activity within the heart. There are two nodes in the heart called SA node and AV node, and this AV node and SA node are responsible for conduction of electricity in the heart, and this electricity can be measured by ECG. So this is an ECG graph. The difference between ECG and AED will be ECG will take readings from the body. It will take readings from the body. Okay, that means it will take electricity from the body and it will measure the heart electricity. But a AED will give electricity to the heart. So AED is output, whereas ECG is in. Okay.
Input.
AED is input and ECG is output. If you're not getting it, I will tell later. So right as of now, you just remember that heartbeat is mediated by electrical activity. But in some cases, there will be abnormal electrical activity in the heart. Due to abnormal electrical activity, heart will beat in a unrhythmic or unsynchronized fashion. There won't be a proper cardiac cycle. There won't be a proper rhythm to the heart. The rhythm of the heart will be diminished due to abnormalities in the heart electrical conductivity. And these abnormalities will occur due to lack of oxygen supply to the heart. When there is a less oxygen supply to heart, at these conditions, heart will go to a state called fibrillation. Fibrillation means abnormal heart rate is called fibrillation. To be precise, abnormal movement of the ventricles of heart is called as a fibrillation. So that is called fibrillation. Okay, afibrillation of the heart. So this is a classical example of afibrillation. This is the normal heart and this is an afibrillated heart. See here, the electrical activity of the heart has been messed up. There is no proper synchronization of the electrical activity. So this will cause here atrial defibrillation. So here it is atrial defibrillation. That means the atria of the heart pumping electrical of the heart, and it will cause obviously this heart will stop within 2 minutes. Abnormal electrical activity heart will stop within 2 minutes. Now I need to reset the normal electrical activity of the heart. If I'm not resetting the electrical activity back to the normal state, obviously the person will die. How can I reset the normal electrical activity of the heart? That can be done by two methods. I need to keep a device inside the heart to maintain the proper electrical activity, and that device is called pacemaker. Pacemaker means it will maintain the pace of the electricity. Pace means it will maintain the rhythm of the electrical activity of the heart, and that is called pacemaker. Usually pacemaker will be utilized, it will be implanted within the body. That is called pacemaker. That we will use usually for the patients who has a severe fibrillation problems to the heart. Okay, heart diseases. Now, during emergencies, no one will have pacemaker in their heart, and they will get a sudden problem. At that time, we need an external pacemaker to keep his electrical activity in the normal state. For that external electrical activity device, that device is called automated external fibrillator. Automated external fibrillator will maintain the normal, it will bring back the normal electricity of the heart. Okay. And why it is called automated? Because when you keep the two electrodes, there are two electrodes of that machine. You just keep two electrodes to the patient. That's it. It will measure the electrical activity of heart, and it will see whether the patient require electricity or not. It will measure and it will give the command. Yes, I'm going to give shock to the patient. Don't touch him. And it will give shock to the patient. It will do it automatically. It will do the reading. We need not to do anything. All we need to do is we need to remove his chest. We need to remove his cloths. We need to keep two electrodes on his chest, and you switch on the device, and the device will measure the electrical activity of the patient. If he requests, it will give a alarm to us. It will say, "Don't touch the patient." At that time, we should not touch the patient, and it will give electricity to the patient, and his heart electrical will be reset condition. So that is the use of AED, automated external defibrillator. Okay, so just see this short animation on usages of AED, automated external defibrillator. Please see the animation. Can you hear the sound
This
of
is a
animation?
defibrillator.
Right?
It can save someone's life, but only if you use
Yeah,
it.
please watch it.
A defibrillator is an easy-to-use device.
Just wait. Are you listening, students?
Yes, sir.
Yes,
Please
sir.
watch this.
Yes.
Yes. Please watch this animation. Yeah.
This is a defibrillator. It can save someone's life, but only if you use it. A defibrillator is an easy-to-use device. You don't need any training to use it because it will tell you exactly what to do.
Shock advised.
Its job is to shock someone's heart back into a normal rhythm during cardiac arrest. However, it will only instruct you to deliver a shock if this is needed. If you find someone unconscious, unresponsive and not breathing, or not breathing normally, they're in cardiac arrest. It's important to act immediately because their heart is no longer pumping blood to their brain and around the body. The first thing to do is call 999 and start CPR. The emergency operator will talk you through what to do and tell you where the nearest defibrillator can be found. If there's someone else around, ask them to go and get it. Defibrillators are normally located in workplaces and public spaces like airports, shopping centres, community centres and train stations. They may be labelled PAD, Public Access Defibrillator, or AED, Automated External Defibrillator, and anyone can use them in an emergency. The defibrillator will assess their heart rhythm and will only tell you to shock them if they need it.
Shock advised.
So you can't do any harm by using one. If a shock is needed, this will try and reset the electrical system in their heart to get it beating normally again. When used with CPR, defibrillators give the best. So, when you witness someone in cardiac arrest, take action. Start CPR and find a defibrillator as soon as possible. For more information on defibrillators, visit bhf.org.uk. Defibs. BHF. Beat heartbreak from cardiac arrest. Beat heartbreak forever.
Yes, sir. So yes, yes, students. See one more real response of AED or real usage of AED on an actual patient. So see this animation also.
In this video, you are going to learn how to use a defibrillator in the event of someone suffering a cardiac arrest. If the person does not respond to you when you speak to them, whilst holding their hand and gently shaking their shoulders, call for help if you're alone, and lay them on their back. Check their breathing by placing one hand on their forehead and the fingers of the other hand under the tip of their chin. Carefully tilt their head backwards and lift their chin so as to fully open their airways. If you see or hear no respiratory movements, nor feel any breath in your cheek, then the casualty is not breathing. Call the emergency services. Ask someone else present at the scene to bring a defibrillator. While awaiting the emergency services, expose the casualty's chest and begin chest compressions by pressing down on the center of their chest at a rate of 2 per second. If you're alone, do not perform any chest compressions, but go and find a defibrillator if there is one nearby. Once the defibrillator has been brought to the casualty, turn it on and follow the instructions that it gives, or that come with it. Take out the electrode paddles from their packaging, remove their protective film, and place each electrode as illustrated in the diagram, included on the packaging or on the electrode itself. Make sure that nobody is in contact with the casualty while the defibrillator is analyzing the casualty's heart rhythm. Follow the instructions of the device, which will indicate you should administer a shock or continue with chest compressions. Continue in this way until the emergency services can take over, or until the casualty begins breathing normally again. This device can even be used on children and infants, normally with a special adapter or using pediatric electrodes. If the absence of these adapters or special electrodes, an adult defibrillator can be used. Place one electrode on the chest and the other on the back at the level of the chest.
So, is everything clear, students? You got some idea about the AED, automated
Yes, sir.
defibrillator, right?
Yes, sir.
Very good, very
Sir,
good.
everything.
So let us, yeah. Any doubts?
No, sir.
No, sir.
No, sir.
Okay, let
Very
us
interesting,
proceed
sir.
to, yeah, really life-saving devices. So in this lecture, I will discuss about definition of AED, principle and working of AED, and how to use the AED, and and I will discuss about functions, safety precautions, and advantages and disadvantages of AED. So coming to the definition of AED, AED means automated external defibrillator. So an AED is an electrical box which is used to stop the electrical activity of the heart. See, when I say stop the electrical activity, that doesn't mean stopping the heart. Here we are stopping the abnormal electrical activity of the heart. Okay. So it is used to stop the electrical activity of the heart when it is in a life-threatening rhythm. Keep it. When the heart is in life-threatening rhythm, that means abnormal rhythm of the heart, that abnormal rhythm will be stopped by the AED. Okay. And this allows the heart to re-establish an effective rhythm. If we stop the abnormal rhythm of the heart, then it will re-establish normal rhythm. Heart itself will re-establish the normal rhythm. So that is a major advantage of automated external defibrillator. So the AED will analyze the presenting rhythm. It will automatically analyze ongoing rhythm. It will only address shock if it is necessary. If it will only give shock to the patient if it is required for the patient. Okay. And also it will advise the operator regarding the step by step guides on how to use the AED. So the principle of AED is simple. It will give a high voltage electric current to the patient. That's it. So a high voltage electric current is applied to the heart muscle either directly or indirectly through the chest. Okay. So this high electricity shock will terminate ventricular fibrillation. The high electric shock will terminate any abnormal electrical activity of the heart. So that is the principle of AED. So this is an actual pictures of AED. In India, See, this is the AED box, and we need to keep a connector to the AED, and it will have positive and negative electrodes. So one electrode will be kept to the shoulder, on the left shoulder, and another electrode will be kept on the this electrode will be kept on the right shoulder, and this electrode will be kept on the left side abdomen. So near abdomen in the left, we will keep this electrode, and after that we need to turn on the device. It will read the patient's electrical activity, and it will suggest us, yes, I'm going to give a shock, please don't touch the patient. And when it's telling, all we need to do is we need to press this red button. When we press this red button, it will give electric shock to the patient. Nowadays, even a small remote is available for this machine. So we can call everyone step away from the patient, and we can press the button of the remote. So it will give the shock to the patient. So that's it. So the working principle of AED is it will automatically checks the victim heart rhythm to detect any fibrillation. It will advise us whether victim needs a shock or not. And the shock is an attempt to return the heart to the normal rhythm. Okay, so what is the procedure of AED? So the procedure of AED is first you need to first you will do your primary response, right? DSR, the sense the danger. DSR, shout for help, respond to the patient whether he's speaking or not, then immediately start ABCD. So A stands for open airway, check whether he's breathing or not. B for breathing, C for chest compressions 30 times, and D for defibrillation. When the patient is not responding, immediately open his shirt, keep his chest, bare chest, and turn on the machine. Okay, turn on the AED machine, expose the chest, attach the pads, one on the left shoulder and one on the bottom, right on the left, one on the right shoulder and one in the bottom abdomen, and plug in the connector and shout everyone. See, this is very important step. After keeping these pads, before turning on the AED, ensure that no one touching the patient. If a normal person got shock, means they will get heart attack. Okay, we don't want to take that risk. We need to ensure that no one touching this patient. So we need to shout once again. We need to say everyone stay away from the patient. After mentioning stay away from the patient, we need to turn on the machine. It will analyze the rhythm and it will deliver the shock. After shock, usually we need to perform CPR until the patient becoming conscious. We need to continue CPR. So this is how we will use the AED, automated external defibrillator. The same procedure in a well elaborated manner here. The same story. First, power on the AED. Second, apply AED pads to the patient. Then third is you clear the victim and give shock to the patient. So it is very important that no one touching the patient. Now that's it. So turn on the AED, keep the electrodes, turn on the give shock to the patient. 1, 2, 3. Very simple, straightforward technique. Okay. Just wait. Now, yes, sir. Um, it's okay, sir. 10 baje, sir will go. Okay, students. Now I want to discuss some safety precautions. Just tell me, think yourself, is it advisable to have cell phone in the patient when we are giving electricity to him? What is your thoughts? Why,
No, sir.
No, sir.
very good.
Sir,
If he has
radiation.
any, yeah, if he has any electronic items in his body, means they will explode. There might be a chance. So we need to ensure that there is no metals or any electronic equipment present to the patient. Second one, is it good to keep the patient in a wet floor? If the floor has water, can we lay the patient on a wet floor? Do you
No,
No,
sir.
sir.
advise
No,
it?
sir.
No, definitely not, right? Obviously, water will act as a conductor and it will give even more shock to the patient. So that is not advisable. And third one is, shall we use AED in an ambulance when the ambulance is on the road, when it is running?
No, sir.
Usually we should not,
No, sir.
right? Because moving ambulance, it will be it will be highly moving, right? It will oscillate a lot, and when we are giving electricity, patient will oscillate. So definitely patient will fall down from the bed. So it is not advisable to give shock during in the ambulance. And also Should anyone touch the patient during, or should anyone give CPR during giving shock to the patient? Definitely not.
No,
Not
no,
at
no.
all. Yeah. So these are the few safety precautions we need to follow during administration of AED, during applying electricity to the patient. So some safety precautions include: do not touch the victim. Most importantly, do not use alcohol wipe for cleaning the victim's chest also. This is one important thing. Usually we will use cotton spirit for cleaning the skin, but that is not required in case of AED. We need not to wipe the skin with alcohol. Do not defibrillate someone around flammable materials. Very good. Okay, the patient is near petrol bunk. In the petrol bunk, the patient will collapse. Shall we use AED in a petrol bunk? Never.
No, sir.
Okay. Yeah, we should not use AED around a flammable materials. Do not use AED in a moving vehicle, which is ambulance. Do not use AED in contact with water. Do not use AED or electrode pads designed for adults to an infant. Very straightforward. Or children AED should be used for children. Adults AED used for adults. If you give adult AED for a children, he will die due to electrocution. So usually it is not advisable to give AED to a child under age under 8. So if the child is under age 8, we should not give AED. So these are the few safety precautions we need to follow when we are using AEDs. Advantages of AED: obviously there are plethora of advantages, right? It will reset the electrical activity of the heart, it will bring the patient alive, it will keep the heart beating, it will also bring back the normal rhythm of the heart. But there are few disadvantages. Disadvantages include over electrocution can occur, risk of getting self-electrocuted during AED. When we are helping them, we may get the electricity. So there are a few disadvantages, but if you see the weight of advantages are more compared to the disadvantages. So it is always AED is better option. Okay. So the conclusion of this lecture is the main purpose of AED is to improve survival rate of the patient, and also AED improves. AED can be utilized by non-professional person also, and also AED can be used in any kind of emergency situations, no matter whatever it is. So thank you very much. I hope the class is clear and precise for everyone. If you have any doubts, you can ask me. Right?
Yes, sir. Thank you.
Thank you, sir.
Okay.
Thank you, sir.
Very good. Yes, I think you don't require any revision also. The concept is very clear. Thank you very much.
Yes, sir.
Let me download that. Yeah.
Yes, sir. Thank you, sir.
See you,
Thank you,
students.
sir.
See you.
सबसे पहले बाल बनाऊंगी और ब्रश करूंगी तब क्लास अटेंड करूंगी